Hello, all my friends in TV land. This is Senior Issues, etc. I'm your host, Vida Verdon, and thank you for watching the show today. And it's a good one. It's the last one of this season, but it's the best. You know, I've always given you the lowdown on things that I think are really important and showed you that if something's happening to me, it could happen to you. Now, the subject matter of our show today is a very important issue. It's dermatology. And I have one of the best doctors here on dermatology. I have one of the best dermatologists here around. And so I want you to get your paper and pencil, hurry up and get your cup of coffee, sit back and relax, because this is vital information that you need. Now, I just want to mention, after the age of 70, or I'd say 75, things were growing on me like I was an old tree trunk that never grew on me before. You know, in my youth, I didn't need a dermatologist, and suddenly this became an important issue. And so what we're going to do is, first of all, I want to tell you how I came in contact with this particular dermatologist. More than a year ago, I had a biopsy done on a little lump on the side, which was benign, but the wound from it, unfortunately, did not heal. And a year passed, and I was very concerned that this still was in an open state. So the producer of this show, Gloria Shapiro, had been going to a dermatologist in Evanston, Illinois, and she said to me, "He's the best, and you have to come to him for a consultation." So that's how I met this man. Now, I know he doesn't brag about himself. He's not that kind of person, but I can brag on him because I'm the host of this show, and I've seen the work that he's done for me. One of the things is, when I first met him, what to my amazement, what I had been fluffed off for a year, he really listened to me and to what I had to say. Not only did he listen to me, but when he talked back to me, he didn't use those 50-cent words that you say, what's he talking about? He explained it to me in a manner that I could comprehend it. And then after he's treated me, and I must say, now I am, and this I have waited for a long time. I wasn't healing at all. And like with the healing process, what I found out, he is the type of doctor that his passion lies, he was really interested in getting me healed, that he was really concerned about me as a person. So I just wanted to give him this kind of salute, that it's our honor to have him on the show today, and his name is Dr. Mark D. Gendleman from Evanston, Illinois. It's our good privilege to have you on the show today. Good doctor. Now, I know the folks out there, we've become friends over the years, and what they'd like to hear is a little something about you. So look right into that camera and tell them a little bit about yourself, okay?
So I grew up in Detroit and went to college at the University of Michigan and medical school at Northwestern, and stayed on and took my dermatology training at Northwestern. And then I decided to stay in Chicago rather than move to Detroit. And I've been practicing in Evanston, near Evanston Hospital, for many years.
For how many years?
About 35.
About 35 years. So you're a seasoned doctor. Good
Yes,
for you. Now, this we like to do like show and tell. Could you give us a brief explanation on what dermatology is?
Dermatologist, I guess, would be an expert on anything related to the skin, diagnosis and treatment. And what I am is a medical dermatologist. I do some surgery, but I don't do the more elaborate surgical procedures that other colleagues of mine do. And I wanted to say dermatology is pretty broad. You could be medical dermatologist, you could be a surgical dermatologist, you can be a Mohs surgeon, which we could talk about later. You can be a pediatric dermatologist, you can be a dermatopathologist and read slides and see patients. You can do research. It's really
So
broad.
there's all different qualifications in
They're all subspecialties of dermatology.
There's all specialties. Okay. Well, let's dig right in. What are you going to talk to us about,
So I want to
Doctor?
talk today about skin cancers.
Okay.
Then I want to talk about prevention of skin cancer.
Okay.
And then I want to try to cover some of the common issues that occur in seniors.
Okay.
So let's jump right in and talk about the most common skin cancer. It's called basal cell carcinoma. And it's, as I said, the most common form of cancer in general, actually. There are 2.8 million new cases of basal cell carcinoma diagnosed in America every year, which is kind of a lot. So it's not that aggressive, but it can cause disfigurement and cause symptoms, and it's you should take care of it. People at risk are light-complected people, fair-skinned people, people with blonde or red hair and blue eyes, and those people are at risk, but it can occur in anybody, really, especially people that have accumulated a lot of sun exposure over the years. It's a combination of chronic sun exposure plus like quick added sun that you get when you're older if you overdo it. And the way that the basal cell presents is a sore that doesn't heal. It's usually a shiny bump with an open sore, and there are large blood vessels on the surface. But the key thing is a sore that doesn't heal, and that's the most common presentation. There are other ways it presents. That's a challenge for doctors in general, but that's the most common way it's presenting. Treatment, there's many treatments for basal cell carcinoma, which makes it easier. A lot of them are treated with, well, after we do a biopsy, we sort of scrape them and burn them. It's called electrodesiccation. And then sometimes we excise them, and if they're more aggressive or if it's hard to get out, we refer them to either derm surgeons or special dermatology surgical people called MOHS, M-O-H-S surgeons, which remove it in layers.
That's what I had.
That's what you had. Yeah, Vita had a basal cell on the eyelid, actually, and it was biopsied, and then she went to a Mohs surgeon, and then she had it reconstructed. Other ways to treat basal cells, we can use liquid nitrogen. Sometimes we use special salves. It's not anything you can buy at the drugstore.
As the prescriptions?
Yes, we do that for superficial type of basal cells, or people who can't undergo surgery, which is unlikely.
Well, now with the salve, then that just heals like a wound?
Well, it's more complicated than that. So you really need an expert dermatologist to instruct you. But think of surgery as being the mainstay of skin cancer treatment. I want to move on to a more aggressive, less common cancer called squamous cell carcinoma. That's there's 700,000 new cases of squamous cell in the country every year, and those present differently. They're sort of a rough patch that is bumpy, and it's not smooth and shiny like basal cell. They're also seen in people of the same risk factors, like complexion, blonde or red hair, people that have had a lot of sun exposure over the years. But there are a subgroup of people that are more likely to get squamous cell, people that are immunocompromised, transplant patients that are on medicines, people that are on chemotherapy. Sometimes they occur in chronic sores and ulcers and stuff. So squamous cells are a little more serious and more aggressive and present somewhat differently. Now, the most important form of skin cancer, of course, is malignant melanoma. And that's the one that has everybody scared, doctors and patients. And that one is usually a mole that turns. And people have lots of moles, but there are a lot of things I'm going to cover later that are not moles, that are misdiagnosed. But if you have a mole that's bothering you and it's changing either physically or if you feel it differently, you should definitely call your...
So the important thing is if the mole has been the same for a number of years and then suddenly it starts changing, that you really should have that looked into.
Correct.
Is that correct?
Right, but there are things that we try to teach the public And patients that have had any of these skin cancers, by the way, if you have one skin cancer, you're more likely to get a second one in that category, and you're more likely to get the other types of skin cancer. So if you had a basal cell, you can more likely get a second basal cell in your lifetime, as well as you're at risk to develop melanoma, which we're discussing now. Now, the way to look at melanomas that we teach the public is we follow the ABCDEs of melanoma. And this is a picture of a melanoma. And what we do is we look at if it's asymmetrical, if the borders are irregular, if there are color variation, if it's a large diameter greater than a pencil eraser, or if there's a change, if it evolves. Any of those signs to you, to the patient, or to us is suspicious for a melanoma. And those are important to diagnose. So I'd like to move on to ways to try to prevent any of these skin cancers. And the most important thing to do is, of course, avoid sun, which by the time these present might be a little too late.
Right now I think it's time for me to go into, and we're going to come back to that, Doctor, my pearls of wisdom. The first thing I'd like to do in my pearls is I'd like to really show the appreciation of myself and the crew to Dennis Edgety of Promex Corporation, which is he is the president of Promex, and that is the corporation that owns the senior building that I live in Libertyville. It's a federally subsidized building, but he is the president of the corporation. And he has believed in this show right from the start, going back to the year 2000, and supported us over the years. So our gratitude goes out to him, and his name is up on the donors list, and we just wanted to say thanks. And the next thing I said, I do research on every guest, what the subject matter is. Now, the research I went online, what I found out is that what it was came over and over and over again is that every senior should have a dermatologist as part of their doctor's package, their doctor's bundle, because that we can't diagnose any lesions on our body, any kind of growth on our body, but a dermatologist could spot it if there's changes going on. So it's very important that you line yourself up in the area that you're living in with a qualified dermatologist. And as the good doctor told us, that there's several types. So it depends on what your framework and what your illnesses have been to the type of dermatologist that you're going to. Now, the next thing I found online that I felt was really important is sunscreen. Now, what a lot of people do is forget the sunscreen, and it doesn't matter that even if you're fair or I have to be of olive complexion, that as a senior, everybody should use sunscreens. And one of the mishaps that happens is if a person is going in the water, whether they're going into a swimming pool or whether they're going into ocean water or sweet water, that when they go in the water, they don't realize, but the sunscreen has come off. So you have to check on whatever type of sunscreen you're taking. But when you come out of the water, you need to pre-sunscreen yourself. And another thing is sunscreen, when you put it on once, it doesn't last for like 16 hours. It lasts, each one, I could say 2 hours, but each one lasts a different length. You have to check with the prescription, and you have to, what it says on the bottle, the directions, and you have to check how often it takes. This is an important thing. And so this is what I want to leave you with today. I want to leave you, stay safe over the summer, watch all the reruns, because I need you in the fall to come back as my audience. So I want you to stay safe and stay healthy. And you have to have a dermatologist that you see twice a year. This is a necessity in your life. Now let's get back to the good doctor and all the rest of the information that we need to hear. Okay.
So we covered quickly basal cell carcinoma, squamous cell carcinoma, and melanoma, but I want to touch on something called actinic keratosis, which is very common and a precursor to squamous cell. And these show up on sun-exposed areas as scaly, discrete lesions that don't go away with time and moisturizing.
Are you going to show us diagram?
No, I'm not going to show a picture. It's hard to photograph that. But it's more like a feel. It feels like a sandpaper bumpy thing on your hands or face or ears, nose. And those are, as I said, very common and can be treated easily with liquid nitrogen. And,
with liquid nitrogen?
Oh, sure. It's the most common treatment. There's a couple other ways to treat them. But those can turn into squamous cell carcinoma. So those are the important 4 things to know about cancer and precancer type stuff. Now, the way to prevent skin cancer, well, sometimes it's too late because avoiding sun since you're early on in life is really key, as you said, especially between 10 and 4. Do not sunburn. In fact, tanning is bad. Even the tanning salons are a no-no. Most dermatologists really hate that and frown on people getting that. And the best sunscreen is clothing and hats. It's better than anything you can put on. In other words, sun doesn't go through clothes. So if you really want to protect, that's the way to go. As far as sunscreens go, as you said, they don't last the whole day. They last several hours, 2-3 hours. So if you perspire or if you go in the water and get it wet, you should reapply the sunscreen, which most people don't do. And number 30 is adequate. A lot of people use less, which isn't good, or a lot more and pay more for it. But a number 30 sunscreen that blocks UVA and UVB is the way to go there. Now, I'd like to move on to common things that we see in seniors that's really important. The first thing I want to cover is something called seborrheic keratosis. And it's very common, and it's misdiagnosed by people as moles. And what they are scaly, crusted lesions. Almost everybody has them. Some people have a few, and some people have a lot. And the key is that they're new. You're not born with them. You get them when you get older. And they're dark, they vary from brown to black, and they're rough. And they're usually on the torso, the trunk, the body. So a new growth that's rough, that's pigmented, isn't a melanoma. Don't worry too much. It's usually seborrheic keratosis. But they can occur anywhere. I see them on the head and face and below the waist. So you should know about that. And I think it's probably one of the most common visits to a dermatologist is, I have a mole that's changing, and it's one of these keratoses, and it's totally benign. It can be unsightly, and they can get irritated, but they never turn into trouble. I wanted to move on to shingles, which is an important thing in anybody, but especially in the elderly. And shingles is less common now because adults get vaccinated, and even kids get vaccinated with the shingles vaccine. Shingles is the same virus that causes chickenpox.
So if you have the chickenpox, you have that virus inside of you.
Right. So the people that get shingles are people that have had chickenpox when they were younger, and the virus lies dormant and then becomes more active many years later. And we don't really know what triggers it, but it's a phenomenon of the varicella zoster virus. Now, the way shingles presents, when it does present, is grouped blisters, and we have a picture to show that. And it's follows one side of the body in what we call a dermatome, and it's usually painful. It's one of the few things in dermatology that presents with pain.
Does it travel?
It can go from the back to the front, but usually on one side.
Just on one side?
It almost never spreads. Beyond a nerve site that we call a dermatome.
Well, I just want to ask a question. For different people, it lasts different amount of time?
Well, the symptoms can vary. I've seen bad shingles that doesn't hurt very much, and I've seen mild, to me, shingles that hurts a lot. So it presents differently. but it's usually painful, and it can last 3 to 4 weeks, 2 to 3, 4 weeks. And the vaccine is very effective in preventing shingles from occurring, but you still can get the vaccine and get shingles. A lot of people say, I got the vaccine, I can't have shingles. Well, that's not true. And the vaccine
So
is...
it depends on the person.
And probably other factors too that we don't understand.
Oh.
And the vaccine is given to anybody, I think, over 50 if they want. Certainly at 55 or older, you can and should get the shingles vaccine. I'd like to cover a couple more things. One is aging.
Aging.
It's a very common office visit for aging. What can I do to prevent aging? And I guess, again, the main thing to prevent aging is you have to be lucky, but it's sun exposure that is a main factor for aging. You can listen to all kinds of cosmetic commercials and read articles in magazines, but all the things that are advertised really only help a little bit. The main thing to prevent aging, besides being lucky and born genetically not being susceptible to aging, is to avoid sun exposure and use sunscreens and clothes and sun protection. The signs of aging, though, besides wrinkles, are brown spots, so-called age spots, so we call them lentiginous freckles. The skin gets, it loses its elasticity, so it gets kind of harder, and you can see enlarged blood vessels, and the color can change. You can get dark or light skin.
I want to ask you a question about your practice. Is your practice, is the bigger percentage seniors, or does it go across the board from any age?
I'm glad you brought that up. We see the gamut of the population, which is one of the reasons I went into dermatology. We see kids and young adults and seniors. But
so
now
it's just not for like seniors aren't just
right.
prone.
Every dermatologist learns dermatology in all ages.
Okay.
And there are pediatric dermatologists, but I know a lot of pediatric dermatology. I wanted to cover one more thing, which is hair loss.
All right.
Which there are a lot of causes for hair loss: medicines, high fevers, operations, cancer and chemotherapy. One of the main things, though, for seniors is, especially women, when they get older, their hair can thin out slowly from middle age to adults. So a lot of older people that I see that have hair loss, it's a phenomenon of getting older, and there's not much you can do. So that's a common office visit.
Well, I want to ask you a question. From the time that you started practice, let's say 35 years ago, I think that's the time that you said you've been in practice, until today, have you seen a lot of changes occur?
Yes.
What is one of the biggest changes?
Well, the main thing there are many, but the main thing is in acne. There's a wonderful drug out there that gets a lot of bad press. It's called Accutane. It's really revolutionized the treatment of acne. And I think of all the things that have come down the road in dermatology, I would put Accutane at the top of the list for medicines that has helped acne, which affects a lot of young people and older people too.
That's really a good effect. Now, you know, my focus has been over the last 15 years seniors, but I know that there's more than seniors that do watch the show. And what I followed the trend is when I started the show, it was like seniors were like a minority, but now we've come into the mainstream, which I attribute to technology and the increase in medicine, and the doctors have so improved. It's not, you know, the down-home methods anymore. It's become so much more sophisticated in what they can do. But what we as seniors have to catch up with in the 21st century is how do we care for ourselves living as old as we're living? That's where I think education is really vital.
That's right.
Do you agree with me, Doctor?
I do, and a lot of people make light of skin cancer, and it is much less serious than some other cancers, but it can cause disfigurement and bleeding, and it can lead to other cancers too, or at least be associated with it. So
But in the treatment of the skin, skin cancer takes a big chunk of things, a big
Yes.
portion.
Yes, at least people that either have it or worry about it.
Uh-huh.
A lot of people have things that change quickly and they come in and all it is a bruise or a little irritation. And I would say, or they want just a general screen.
Uh-huh.
I want my skin checked for skin cancer. It's a very common office visit.
Now you refer to yourself as a medical doctor. I want to make this clear to the audience because
Medical dermatologist.
A medical dermatologist. I want to make this clear to the audience that there could be a dermatologist that is not a medical doctor.
Yes, there are people that claim they're dermatologists that don't go through an approved residency, so they aren't technically what we would call dermatologists. There are very few of them, though.
Well, what I want to do is give the right advice and information out to our friends, you know, because we've become close over the years, all the audience that's watching us in TV land, that I think that they should check with any doctor that they're going in, depending on whatever is wrong with them, whatever they're going into the dermatologist to really define. Now, do you mind very much if people would call you and ask you questions? Would that be all right?
Sure.
Okay. Now, do you want to give your telephone number? I think that's important.
So I'm in Evanston, so it's 847-475-4556.
Now, that's a freebie. Now, listen, you need to really take care of yourself and check on this if you have any questions that you want asked. Now, this is a good opportunity for you because remember what our goal is, to live forever and really take care of ourselves and be safe. Now, there's one question that I ask every guest that's been on the show, and that is exactly where does your passion lie? I know where my passion lies. I feel where God above has placed me in this position. So it's my job to bring education to seniors on how to care for themselves. Now, you as a doctor, you're in an important field, a very important field. Now, where does your passion lie? Maybe you could just look into that camera there and express it. What gratification are you getting out of it?
I think I became a dermatologist to help people. And I'm a people person. I like phone calls. I like talking to people in the office and on the phone. And when I first became a dermatologist, we got a bad rap for not helping people that much. But I would say that almost everybody that leaves the office is better than when they came in. Whether it's a diagnosis and I can help them there, or I can refer them, or I can treat them, and it's rare to not get somebody better. So the satisfaction of people leaving a dermatologist's office is very high.
Now, you've heard the best. Now, you know what it is now. And you know, this is such good information. We're going to have the good doctor back periodically so he can give us updates. But you know, when you out there, you that's sitting on the couch that has been watching all this, come to the end of your rope, you know what you do? You tie a knot and hang on. Do you know why? Because the best is yet to come.